I am Dr. Sayede Fateme Mahmoudabadi, a pediatric dentistry specialist, and I want to accompany you in this video with one of the special treatment cases. Ali Reza is a 4-year-old boy, and due to the large number and extent of his dental cavities and his lack of cooperation with treatment, we decided to treat him in one session under anesthesia. Why did I choose this case? Because it has a lot of important points that I suggest you don't miss.
So join me in treating my dear Ali Reza. A few days ago, when Ali Reza came to my office, I examined him clinically and also prepared an initial treatment plan for him.
I didn't report any history of infection. On the other hand, since they insisted on preserving the anterior teeth, I suggested that at least this tooth could be kept for a while. In my opinion, SDF works well for baby teeth, but tooth number 1 is suspicious.
I think I might have pulp involvement. What was recorded in the initial treatment plan? 6 primary molar teeth need pulp therapy. It is likely pulpotomy, but it is not certain. 2 second primary molar teeth only need restoration. And for the 4 anterior teeth, we said we will use SDF. But 2 teeth had some mobility and their condition was questionable. No diagnosis without an X-ray, especially for dental treatment under full anesthesia, is reliable. The probability of error is high, but Ali Reza neither cooperated with periapical X-ray nor panoramic. That's why, under anesthesia, before starting the treatment, radiographs of all the primary molar teeth and anterior teeth were taken. The treatment plan did not change much except the 2 maxillary central primary teeth, which had significant root resorption and could no longer be retained.
So, with informing the parents and obtaining their consent, it was decided to remove them. Let me mention a subtle but important point here. Before starting the treatment, thoroughly apply Vaseline around the mouth and lips to protect the lip tissue from damage, stretching, and cracking when using the retractor.
In this case, we want to review the steps of pulpotomy and stainless steel crown for the primary first molar on the right side of the mandible. I used cotton rolls, a cheek retractor, and an open mouth pulp guard from Alterdent Company for isolation, which effectively retracts the cheek and with some skill provides sufficient and reliable isolation during anesthesia. First, we start with decay removal with an angled round burr of a size suitable for the cavity decay. I make sure to remove the decay from around the center to prevent pulp contamination as much as possible. After removing the decay, it is time to prepare the access cavity for pulpotomy. Here I used a fissure burr and a turbine. And since I want to restore it with an SS crown, I am allowed to shorten the occlusal surfaces from the start to have better access to the pulp. With sweeping motions and care calculator, complete the access cavity. Fucente, fiche.
Now it's time to cut the coronal pulp from the orifice. I used a round burr or a finer one. It took just a few seconds, very short and quick. I cut the pulp without applying pressure.
If the pressure and time are excessive, it can damage the coronal pulp, which is very important for pulpotomy. After washing with serum for disinfection and removing tissue and dentin debris, I use sodium hypochlorite for only 15 seconds. Remember, the goal here is not to stop the bleeding. I take the sodium hypochlorite cotton, I rinse again with serum, and this time I press serum moistened cotton gently inside the pulp and let the natural coagulation process occur. Something around 3 to 5 minutes. For medicament on the cut pulp inside the canal, I use the whole ceramic, which is mixed with distilled water and is a bioceramic material that has shown high success and is comparable to MTA in primary teeth pulpotomy articles. Now it's time to take the wet cotton roll.
I transfer the entire ceramic into the cavity with an amalgam carrier and pack it well with a slightly moistened cotton pellet, so that it completely covers the floor of the cavity and has a thickness of about 1.5 to 2 millimeters. I chose a reinforced zinc oxide Eugenol base that sets very quickly. I also transfer this material into the cavity with an amalgam carrier, because it is both more precise and cleaner. The pulpotomy treatment is complete. Now it's time for the stainless steel crown. I open the contacts with a medium length metal needle, not long, on the occlusal surface that I previously shortened. I do it with flowing and careful movements. I slightly bend the buccolingual wall and finally round off the sharp angle. Now you can remove the tongue retractor from the mouth opener to make access easier for testing and cementing the crown. The number 4 stainless steel crown was small, so I chose number 5, which seems to need good contouring and crimping. After disinfection and drying, the stainless steel crown is prepared for cementation. In the meantime, after rinsing with a jet, I hold a gauze with slight pressure on the tooth. The SS crown is ready. We break it from the lingual side towards the buccal, slide it over the tooth, and with a seating band, ensure the final correct position of the SS crown. Now it's time to remove the excess cement, first with gauze and then with a probe. I'd cycle.
In this case, I'm providing it as a reference for you friends so that we can achieve the best results using these tools.
Finally, SVMEMA, it's time for the STF on the B teeth. Applying STF on the decayed area of the teeth for about 1 minute is sufficient. The A teeth, which showed significant resorption in the radiograph, were easily extracted with multi-grip anterior forceps. And as expected, the resorption had affected slightly more than half of these teeth.
Thank you for being with me. I hope this case has helped you gain a more realistic perspective on your diagnosis, decision making, and treatments. If you found this video helpful, make sure to like it. Don't forget to subscribe because we're going to explore lots of practical points, real cases, and challenging decisions. Wishing you success and victory.